Good afternoon, ladies and gentlemen, and welcome to the Healthcare World Festival on what in the UK anyway is a cold but sunny morning, and a little bit later on in the day, hopefully a little warmer in Dubai this afternoon, where most of our panelists are sitting. In fact, all of our panelists are sitting. Welcome to today's session, following on from a great session yesterday on entry to the US market. Today, we're going to focus on a different health economy, the health economy of Dubai. Always a fascinating area of the world to work in, and one that I've been had some experience on over the last 10 years. It's the gateway to the Middle East in many ways. It's an ambitious health economy, and it's been really a starting point, I think, for many companies that want to enter that region. Joining me to discuss opportunities across that region today are Andrea Tydcott from law firm Al Tamimi, Farah Sheikh from IQVIA, Marwan Abdulaziz, who is the Managing Director of the Dubai Science Park, Dr. Haider Al-Youssef, who is the Managing Director of Al Futtaim Healthcare, Osama Al Hassan from the Dubai Health Authority, and I almost feel like saying our own Mazin Qadir, who is of IQVIA, but also a huge friend of Healthcare World, who's helped us to pull this session together today. So without further ado, I'd like to get into the conversation. Now let's start by having a look at what's been happening over the last 12, 18 months in Dubai. It's been a testing time for all of us around the world. How has the Dubai health economy fared over the course of the last 18 months in the global pandemic? And I'd like to start, Andrea, by coming to you as our doyen and of knowledge on all things Dubai health economy. How's it been? What's been happening in the health economy of the region?
Hello, everyone. So my name is Osama Hassan. I'm from Dubai Health Authority at Department of Smart Health and Health Informatics. So actually, it has been a really tough 18 months for everyone. However, I believe that Dubai in general, in particular, and the UAE in general, have done a really great job in understanding the challenge and trying to deal with it. So I think the good thing that the challenge of COVID was addressed by the top authority of the UAE, and they put it there in their first agenda. They dedicated full resources, full manpower to manage this pandemic. And I believe that even they took a very good course in trying to leverage technology as much as possible to collect data, to understand the actual details of the challenge, and to address it through even digital solution, starting from mobile apps to connect directly with the entire population of the UAE, to let them know what are the best courses of fighting pandemic, how to diffuse the immunization as soon as possible, how to make evidence-based decision with regard to lockdown or opening up the market. And I believe that DHA and other health regulators were very, very supportive on this perspective by providing the evidence-based data for the leadership to make the right decisions at the right time. So I think this is what exactly happened. And I believe that we are very, very close now to say that UAE is almost done with the toughest part with regard to COVID. Thanks.
Thanks, Osama. That's a helpful start. Haider, if I can come to you as a healthcare provider, how have you coped with the pandemic as a provider of healthcare in the region?
Well, obviously, the pandemic brought in a number of challenges, but also brought in a number of opportunities. And I think what we've seen is the agile healthcare organizations have managed to sort of modify their strategy a little bit in order to deal with the pandemic and as well maintain their cash flow and maintain their economic sort of status, if we say so. So we definitely footfall to clinics have gone. I mean, we're fundamentally primary healthcare organization. So we've got a number of clinics all over Dubai, and we have seen drop in the direct footfall to the clinics. But one of the things that we've done right from the beginning is to design digital to be part of the overall offering. So we were first in the market to go with telehealth and a complete sort of remote health offering, which proved very, very useful, and we've seen a significant uptake in that. And as the pandemic sort of got down, we saw numbers dropping, but a lot of the people that have adopted digital actually started enjoying digital because it's also more convenient, and it brings in an additional layer of sort of convenience to them, really. On the overall diversifying your revenue stream, like going into COVID testing, into COVID facilities, have helped us to recover and to make sure that we don't drop below our budgeted numbers. On the overall, I think the private sector in Dubai, like Osama said, has been a significant supporter to the government in the fight against COVID. I think we've worked hand in hand with the government to ensure that the entire population gets access to testing in time, to facilities, to whatever level of service they require in the support of COVID. If you look at this from the insurance companies' point of view, insurance companies obviously initially had a significant drop in utilization and they started to accumulate a little bit of money. But then as they started to pay for COVID, they immediately started using that amount of money. And eventually they paid for COVID and they also paid for the backlog of services that people started getting as the COVID situation improved. So I think on the overall, it hasn't been catastrophic to those organizations who've managed their diversity of service offerings well. But other smaller organizations perhaps have suffered a little bit as a result of the pandemic, especially those who have not managed to get onto the COVID service range and respond to that in a fast manner.
I think this is something that particularly we in the UK don't appreciate about a health economy like Dubai, which is that a pandemic like this, the economics of it are a struggle. And actually being able to not just service patients, but also keep your cash flow robust and keep your business afloat is something that, in the UK, where the NHS is paid for entirely by government, it's a completely different situation. Marwan, if I can come to you, how have the sort of resident companies at the Dubai Science Park coped with the economic realities of dealing with a global pandemic?
So a good number of companies were part and parcel of the response to what was happening during the pandemic in terms of providing equipment, testing, sanitization, etc. So I would say a good number of companies, in a way, benefited from what happened. And in fact, we had an increased number of companies registering last year. Compared to other years. So in general, I think we have been fortunate in that sense, but also this has also opened our eyes onto how important digital health is as a segment of the market, and that's something we are trying to address and trying to create the right environment for.
Thanks, Marwan. Mazen, to come to you, you obviously have an interest and a strong knowledge of digital healthcare across the Dubai healthcare system. How have you seen that start to be more utilised as a result of what's been going on in the last 18 months?
I think the speed at which digital transformation has been happening has been astonishing. Specifically, as we went through the COVID-19 period, so early second quarter 2020, and then moving on into the upcoming months in 2020, has shown us that there was a huge speed from which providers, payers, and technology partners have actually been participating in. So the acceleration of the digitization has been noticeable, buddied up and coupled up with hyper legislation mode, right? So regulators have gone into this ultra fast way of regulating and issuing policies and whatnot. Technologies are no longer going through the cycle of waterfall, project management, collect requirements, design, test, validate, and implement. We're talking now at a fast speed where you see minimum viable products being put quickly. And this is very evident from the rollout of Al Husn app, which is a national UAE app that monitors PCR and vaccination status for every individual in the UAE. And this is linked up to the Emirates ID. The rise and the implementation of such an app on a very fast, small scale showed that Regulation is on hyper mode. Automation and digitization is going into minimum viable product as soon as possible to the consumer, immediate mobilization and execution of digital solutions as per the need. And as Dr. Haider said, and Marwan said, technological companies or technology companies have risen to the race.
So it's a good time then for good technology companies with good products to be coming into the market in the region. Hyper legislation, Andrea, that sounds very much in your wheelhouse. What's your experience of hyper legislation then?
Well, our experience, and completely agreeing with Mazin, our experience during the pandemic as lawyers and healthcare lawyers, we have specialist healthcare practice here at the firm. The pace of regulation was astonishing. And also what was equally as astonishing was those new laws and regulations being delivered in a very organized and systematic way from cabinet down, from cabinet through Ministry of Health, through the health authorities, through the Ministry of Labour in terms of protecting the entire workforce from infection risk. We had to be quick on our feet as lawyers to keep track of new laws that were coming out on a daily basis. In addition to that, and of course, initially those new laws were really focused on protecting people, keeping them home safe and well, then return to workforce measures, social distancing, PCR testing, vaccination, not mandatory, but a huge choose to vaccinate program, and achieving a very, very high percentage of population vaccination now. In the midst of that, the digital transformation, which took on, as Osama said, a life of its own. We saw so many developments in law concerning the digital transformation, the rollout of telehealth, and all of the adjunct technologies to support that, home monitoring, software, applications on your phone, on other devices. It was quite extraordinary. In the middle of all of that, the legislator also thought well of protecting private sector health facilities who, due to the drop-off, as Haydar says, due to the drop-off in footfall through private sector hospitals for routine non-urgent matters, protecting those facilities from court proceedings, debt proceedings, and other kinds of litigation, just to keep the whole sector stable, just at the right time when it needed that element of stability. Now, 18 months or so later, what we're seeing is a lot of attention now to data. Now that we have all of these tools at our disposal, the country is holding a lot of data and needs to decide what it's going to do with it, who's going to have access rights, where it can be transferred, and to the extent that there are companies out there that can perform analytics on the data, how are we going to do that, and how are we going to monetize it but protect patient confidentiality? And that also is driving the M&A market, because there's so much interest, not only in tech companies, but in how facilities are organizing their clinical services aligned with their technology services, and how the transformation in the delivery of clinical services is going to impact the health economy going forward. There's quite a bit of law that's emerging in that space. So it's very exciting times.
It really sounds it, actually. And I want to sort of dive a little bit more deeply into some of the things that you were talking about there. Interesting, one comment that I would make to what you just said. It's very interesting to see the way in which government in Dubai dealt with the situation, the economic problems that came out of the global pandemic in terms of protecting companies, protecting the supply chain by moving some of those rules around. That's quite fascinating. Farah, I want to come to you briefly as well. From an IQVIA point of view, what have you as an organisation been up to over the course of the last 12, 18 months while all this chaos has been reigning?
Touching upon what Andrea mentioned, I think IQVIA has a legacy of 6 decades of data and data analytics. So we've been very busy in working with regulators, working with the governments in terms of population health management, looking at how we can use the power of computing, how we can use, the data for both clinical research as well as real world research, and to see if that can translate into better disease management and surveillance at a provider level. So call to action and how these can help enable the providers for better patient care across the patient journey.
No, that's really, really interesting. I mean, I think this question about how it's changed the ambitions and the requirements of the health system is really where I want to go next with that. And Osama, I'd like to come back to you, if I may, because DHA, you've always had some pretty strong ambitions in terms of where you want to see the health economy of Dubai going and what you want it to achieve. How has the pandemic changed that? I mean, how are you now looking at what you want to achieve in the region's health economy?
Well, thank you very much for the question. So what I can see, one of the good lessons that we learned from COVID, that we cannot handle healthcare systems in a separate mode. Like we're having an ecosystem in Dubai and Abu Dhabi and then Mohab. So we realized that in certain situations, we need to work more closely with each other. And we are now raising more federal initiatives. So I can give you one example. So although that we have health information exchange in Dubai and in Abu Dhabi and another third one in Mohab, we are now working very closely to link them to each other. So in order to have a single population health storage or a data store that we can use to make decisions, make better decisions and better insights. So more collaboration between different health regulation systems. Also, we see now a demand coming from the upper authorities with regard to increasing the competitiveness of the market. And we believe that the healthcare is part of that market. So because of that, we are pushing more of regulatory regulations that allow more trust to the system. So we are now introducing HIPAA-like regulation, GDPR-like regulations to make sure that patients and other parties in the healthcare ecosystem are having more trust, more confidence in the healthcare system, more confidence in health data sharing processes. And I believe that this will open up a lot of opportunities, especially for legal, regulatory compliance companies to come to the market to make sure that all these processes are done in a fashionable way that really preserve confidentiality of the patient. Things like consent management solutions, even a cloud-based solution that respects the new regulation the way. These kind of solutions will find a lot of demand in the coming few months. Thank you.
Really helpful, Osama. Thank you very much for that. Mazin, to come to you, it sounds a little bit to me from what Andrea and Farah and Osama were all saying, that there seems to be a shift in ambition towards building a really strong digital health ecosystem. Is that correct? And what do you see that digital health ecosystem looking like?
Absolutely. Just to reemphasize Dr. Osama's point, last week, for example, we had a conference that brought in all regulators in the UAE. The coordination and the level of integration that is required, specifically as we embark upon the next 50 years of this wonderful nation's life of achievements and progress. There is going to be a huge level of demand when it comes to building that infrastructure, specifically for healthcare, to coordinate and integrate health systems, to actually bring in more laws and regulations to manage and govern data, privacy and confidentiality, definitely bringing in the latest and greatest technologies as we embark upon Expo as well. At the moment, we are in the middle or during the wonderful journey of this Expo, huge kind of activity or a set of activities that is bringing to us at the doorstep of the UAE a number of innovations and technologies that are able to showcase where would be our next 50 years of this young nation. So again, the idea of actually bringing in a unified health information exchange that you can actually build a huge, robust research and development, bring in more talent, develop more competent workforce of the future, be able to bring in healthcare to the next paradigm will be definitely based on the roots of some of the initiatives that have been put in place and the coordination that is happening between the regulators and the partners, stakeholders in this economy.
So it sounds like there's been a subtle shift in terms of the way that the health economy is building. Marwan, I know you deal with a lot of companies and a lot of organisations that want to enter the local health economy, mainly because they base themselves in your facilities. What have you seen in terms of the volume of organisations trying to enter and trying to get involved in the Dubai health economy? Has that remained robust? What sort of flow, what sort of companies are now coming to the UAE to set up their healthcare businesses? I think you're on mute, Marwan.
So it's usually a mix of companies. I mean, although Dubai and the UAE has the majority of the large companies as regional headquarters, so that I think we have reached a saturation level of. However, the wave of companies that are coming are usually smaller companies that are more innovative, that are more driven in terms of their services and their innovations. And a lot of them today are no longer only looking for a space to set up, but mostly information, what's happening in terms of the rules and regulations. Do they fit in? Are they following the ever-changing laws that this country is seeing? But at the same time, data, I think, is king, and it's really the language and the currency of today. And I think it will continue to be more and more valuable. So what's happening at a federal level and also at the local level in terms of governing the data, who has access to what, and where, when, and how it can be shared. These are all very important questions that I think will determine the new wave of companies.
And what's the volume been like? I mean, presumably you saw a drop off in inquiries and companies wanting to enter the health economy during COVID. Is that recovered now?
Like I said, we did not see a drop off. We did see a little bit of a slowdown, maybe from the month of, let's say, March up until June or July. But then there was a big, ramp up and quite a busy period after July of last year. So we were able to register 40 new companies last year. And I think this year we might even exceed that number.
So from that point of view, not really much of a change in terms of, in spite of the fact that you've had circumstances against you. Haida, to come to you, I mean, we're talking here about the ambitions of the health economy as a whole. What about the ambitions of an individual healthcare provider, particularly as a primary care provider? How has the pandemic changed your objectives, and where are you looking to grow? Where are you looking to go next? You're on mute, Haida.
So for us, I think one of the advantages that we had is that our strategy was a very physical digital strategy right from the beginning. And we wanted to have digital as part of our entire ecosystem where people use and access the healthcare system in whatever way sort of convenient. And at the same time, the health system wraps around them to actually improve their health, their overall health. That value proposition, I think, is not a common one in the health sector, and that allows us to scale our business significantly and punch way above our weight, in the sense that even though we've got, let's say, 20 sort of clinics on the ground. With the reach of digital, we could actually cover a much larger geographic area. And then this is a model that as a group we wanted to scale up. So we're already expanding into the Northern Emirates. We're moving into Egypt, Saudi. So we're building now a much larger scale using the success of the original model that we've created in Dubai and leveraging the digital strength that we brought into the offering, which set us apart from our competitors.
So what kind of, just to delve into that a little bit more deeply, what kind of technologies are you utilizing?
Well, we look at patient engagement solutions across the board. So we start from a lot of app type engagements for obviously doing basic things, booking appointments, checking your results, having conversations with the healthcare provider, engaging with the healthcare system, getting a lot of customized healthcare information that is relevant to you, into then telehealth, sort of video consultation. We brought into the market a gadget that we've called Smart Doc, which basically is a gadget that travels to the patient and allows the doctor to remotely examine the patient. It's basically a remote assessment tool, and it allows the doctor to examine the patient head to toe remotely, which means the doctor from his or her clinic can actually manage 4 or 5 different locations. We have nurses at those locations, and with these gadgets, they can listen to the heart, listen to the chest, look to the eyes, look to the ears, assess the patient fully, and then with the presence of the nursing team member, collect blood samples and run pretty much a complete consultation with then medication delivered to the patient. So suddenly we've created those smart solutions everywhere that again increase access and convenience and bring a bit more to the table. And then all the way into chronic disease management program and different engagement solutions using omni-channel communication with the patient. So we've created an entire digital ecosystem that sits on top of our physical presence and creates this whole unique offering to the patient.
Wow, that actually sounds really, really impressive. How have patients found this to work with? I mean, have you had any problems in getting patients moving away from, I guess, what would be the traditional ecosystem of going to go and see a doctor physically to moving to utilizing those technologies? How have they reacted to it?
The most difficult step has been the initial introduction, and obviously the pandemic took care of that. So it brought a lot of patients to digital where perhaps they may have been a bit more reluctant to do so, but now they don't want to take their kids, the elderly, even themselves and families to the clinic. So they try the digital solution. They like it, they enjoy it, and they think, wow, that's fantastic. I don't need to take half a day off of work or of something that is very valuable to me. And it's a 5-10 minute video consultation, see my doctor, get everything done. So once they use it and once it actually works, because that's the other problem with digital solutions in healthcare, a lot of them are not convenient. They don't work. They send you a link, the link doesn't work, the doctor's not there, you're not there, the technology fails it. Other sectors like banking or hospitality or sort of tourism, you can see that the technology have developed really, really well. And today you cannot imagine not buying from Amazon or not, sort of using your banking app. But in healthcare, the technology hasn't been convenient enough. It's still been a bit slow. However, the moment it becomes convenient and user-friendly and people use it and it adds value to their quality of life, then that's where the adoption takes place significantly. And that's the shift that we have seen ourselves.
No, that's a really, really interesting, really fascinating way of delivering healthcare, and something that we talked about at the festival in the last couple of weeks, this idea of how to digitize your health system. It almost feels like you've kind of almost cracked that whole thing. I mean, from that point of view, it seems as though you've got this kind of digital revolution going on in the health system of Dubai. Andrea and Mazin talked about this earlier on, the kind of changes in regulation, the ability to bring products to market more quickly. What's been the kind of regulatory and legislative action behind that? Have things changed in the regulatory system to allow these kind of technologies to move quickly into market?
So we're currently seeing regulation on various different levels in this space in order to generate investment in the healthcare economy. So let's start from the very highest level. A few months ago, earlier this year, Dubai established the Dubai Academic Health Corporation, The objectives of the Dubai Academic Health Corporation are to set that standard, that gold standard of Dubai having the best healthcare system in the world and having all of the infrastructure in place to support that, including medical tourism and including investment into scientific research and development and all of the wider infrastructure aspects. So that is top level, that is new. So, it's just been cooked, it's come out of the oven, and we're expecting that to do great things in terms of setting at policy level that expectation that we're really going to drive the healthcare economy into the future very quickly now. Turning to your more direct question, during the pandemic, the health regulators have put in place fast-track systems for registering products. Particularly, for example, if you had a COVID-related product, whether it was a sanitization product or a testing kit or any other product that has any sort of COVID-related benefits would be fast-tracked. Now that's sort of extending into accelerating registrations across a whole range of other products, and will eventually trickle down into non-related COVID treatments, because of course what we want to see now is medical equipment and devices being registered a lot faster, and what we need to have is some focus on the arrangements, the laws and the processes for registering software as a medical service in relation to those medical devices, software that is related to, adjunct to, and that aids and supports diagnosis and treatment recommendations. There we have a little gap there in terms of regulatory development work that needs to happen. Meanwhile, it doesn't stop anything happening. You can still do those things, have a conversation with the regulator. Wonderful thing about the regulators here in Dubai is that they are very open and amenable to having conversations about embracing new medical technology and all of the software that goes with it, and finding a solution for product manufacturers in order to enable them to enter the market. So there's a lot happening on the regulatory side in terms of product development. Obviously, with these fast-tracked systems, we have to make sure that we have a balance between speed along with safety, efficacy, functionality, and all of those other things to make sure that the safety needs of the population are protected while we roll these things out at speed.
There's a lot of new things happening in terms of bringing products into the market, and I know that, and I want to come back to this a little bit later on in the conversation, that there has been some conversation about manufacturing and encouraging manufacturers to base themselves in Dubai. I want to backtrack a little bit and come to Osama with this next question though, because certainly in the past when we've had these kind of conversations, we've talked about the idea of creating centres of excellence around particular specialisms. Is that idea still alive and well, and where is that in its process at the moment? Osama, do you want to address that one?
So in what sense you mean center of excellence? Do you mean like in artificial intelligence?
So there was
in general?
So a number of conversations that I've seen over the last couple of years around establishing kind of world-class clinical services in particular areas. I think there was some work around cardiology that was done, various other bits and pieces. Andrea, help me out on this one. This was stuff that you were involved in, wasn't it?
Just making sure I'm off mute. Yes, so centres of excellence. Centres of excellence are part of the strategy for the country, with particular initiatives in place by the Dubai Health Authority and the Department of Health in Abu Dhabi. There's a great deal of emphasis on developing specialties, developing expertise. Each of the health authorities have put in place a number of measures, which are kind of broadly similar. So from the point of view of either a clinical provider or investor looking at these opportunities to set up centers of excellence, it's broadly the same in both Dubai and Abu Dhabi, in that each health authority has put in place either investment guides, as is with Dubai Health Authority, or master capacity plan arrangements, as in the case of Abu Dhabi Health Authority. And those map what is required in terms of centers of excellence. And then, of course, there's encouragement to set up those centers through a sort of certificate of need type examination of the matter before the license is granted. And that, combined with other measures that are put in place for accreditation and licensing generally of centers of excellence, it's really setting the bar quite high in terms of having those centers of excellence in country. And that is also supported by some wider laws that have been put in place to generate public-private partnership relationships, new PPP laws that form an embracing governing law environment in which those partnerships can happen. And we know currently that Dubai Health Authority are very active in identifying opportunities for PPP investment and partnerships to happen, and for the development of new centers of excellence. The Cardiology Center of Excellence being the prime example, but there are many others, and I know they have a long list of centers of excellence that they wish to roll out in the short and medium term.
So that's where I was kind of coming from with that question, because obviously we've been talking over the course of the last half an hour about new initiatives around digital healthcare, around bringing in other providers, etc., etc. But I wanted to just check and sense check that those existing programs were still in place and to see how they were progressing. So it sounds from what you're saying, Andrea, as though they are still very much current and there is still a lot of activity going on around them. What other opportunities are there around the health economy of Dubai? What other things are going on? What should be people be aware of? Farah, I know you wanted to address this, and then Marwan.
Farah, go ahead.
Yeah, I mean, I wanted to comment on the Center of Excellence's point a little bit here. The cardiovascular is a good example. It could be disease specific, and we can attach that to national priorities of UAE and work with the different governments, whether it is the Department of Health, Dubai Health Authority, or the Ministry of Health. But I think where we should be headed, and that leads into your question of what opportunities exist, is to align on how these center of excellences need to impact patient lives. So we bring that back to the care model itself. How do we make it more efficient, the system more efficient? How do we look at better clinical outcomes while doing that, and also contain costs? So if we look at these three, the use of artificial intelligence, and there is a Center of Excellence for Artificial Intelligence in the Department of Health, but we should look at that UAE-wide, and then also maybe genomics, maybe some predictive analytics. So there are these initiatives that can drive some of the national priorities around cardiovascular, metabolics, maybe rare diseases, oncology, and that's what I just wanted to add.
Kind of links together both of the themes that we've been talking about, doesn't it? Marwan, you wanted to come in.
Yeah, I think, generally speaking, during the pandemic, there were two big items that were spoken about. One was food security, and the other one was medical security. So, from food perspective, do we have the right sources to keep the country going, to feed its population? But also at the same time, do we have the right necessary medicine for us to survive, and also to help the nations that we want to support? So one of the things that were highlighted was local manufacturing, and how much of it is, and how much Dubai and the UAE is heavily reliant on imports. And I think the latest statistics says that only 7% of the entire UAE market uses locally manufactured medicine or drugs, which in my opinion is a very, very low number. And we should do things to increase that. And I think the Ministry of Health is aware of that. And there are a number of initiatives being rolled out to encourage local manufacturing, not only for the local market, but also taking advantage of the robust logistic infrastructure that Dubai and the UAE has, where it can, send across medicine globally to all parts of the world.
It's something actually that I've heard in conversations with the Dubai Health Authority over the last couple of months, is that there is a move towards encouraging investment in manufacturing and manufacturing in the life sciences sector. Mazen, is that something that you're aware of, something you can comment on?
I believe definitely it's aligned with the Dubai Industrial Strategy, the DIS, that came out with a huge focus on pharmaceutical and life sciences. But again, going back to Marwan's point, we have initiatives that have disrupted the supply chain world. The HOPE Consortium that was masterminded in Abu Dhabi, collaboration between the private and public sector. The vaccine supply chain that has been created out of the Emirate of Dubai, collaborating airlines with logistical powerheads in the United Arab Emirates and the Emirate of Dubai. So yes, I believe there is definitely a focus on bringing in manufacturing capabilities in the pharma life sciences. There's definitely a drive to bring in the innovation that comes with it. And you can see this with obviously the efforts that has been done by the United Arab Emirates government, and specifically in Abu Dhabi, the logistical kind of disruption and achievements that they've done in moving manufacturing capabilities for vaccine, the rise of G42, the companies that are coming in with huge powers and collaborations and partners to set up hub in the UAE and start spreading the knowledge and spreading obviously products across Africa and South Asia. So again, there is a drive. Dubai Industrial Strategy is a evident for that, and definitely one of the big focus areas in the 50 years strategy that has been launched by His Highness Sheikh Mohammed bin Rashid and leadership team of the United Arab Emirates, that will be the focus in the next 50 years in the United Arab Emirates.
So from that point of view, Marwan, coming back to you again, what kind of organisations, what kind of companies, what kind of manufacturers are we looking to encourage to enter the market?
Well, I think, it should be very much aligned with the needs of the market and what the market needs. Looking at, the product where their IP is finishing, so there is a big chance for generic manufacturers to come in. Obviously, we need to build our manufacturing capabilities, starting with generics and then going into devices and then going into biotech products. At the end of the day, we're still a young nation, and we don't have the sophistication when it comes to manufacturing, and we're still also developing the talent that is required for that. But there is a lot of opportunities in different areas, whether it's diabetes, cardiology, oncology, and also in nutraceuticals. I think one of the key things that is important for manufacturers, one is speed of approvals, regulatory body approvals, and secondly is how much access does Dubai or the UAE give them to new markets. And if you look at markets such as Africa, for example, that are landlocked and don't have access to ports, and the airline logistics that we have, especially Emirates Airlines, have invested in pharma logistics by the name of Sky Pharma. And I think Abu Dhabi is doing similar as well. So and cold chain logistics that are available in the free zones and in the ports. All of that enables the whole manufacturing ecosystem. So I think we are at a quite unique position for us to have more manufacturing, not only for the local market, but also for exports.
It's interesting. I mean, it's to me, this feels to a great degree, and I think Mazen spoke to this a moment ago, that a lot of this is around trying to create a more self-sufficient health system in Dubai, and that in itself is clearly a consequence of the pandemic and a consequence of what's been going on. And to move to a different element of that self-sufficiency, one of the other problems that I think that we've always had is that of workforce. Andrea, coming to you for a moment, how is, are you seeing any kind of moves in terms of regulation, in terms of the way in which the health authority is putting things together to try and address the issues of being able to get enough people into the health economy?
Thanks, Steve. I think there are two points here from a legal perspective. The first is that we've just had a brand new labour law published. The previous labour law, which went back to 1980, has now had an overhaul. So we've just had a brand new law that's been issued now, that's more fit for what the country needs and what the economy needs in terms of supporting workforce needs going forward. In general, there have also been changes in the laws and the procedures for obtaining visas, and those visas being much longer visas for expatriates to stay in the country. So that really encourages the workforce to stay here for longer periods. So rather than folk thinking that they might come for 1 year or 2 years, now the country is looking at a much longer term stable workforce supply in general. Now, in particular, when it comes to the healthcare workforce, there are a set of unified regulations in place that apply to the professional licensing of healthcare professionals, whether they're doctors, dentists, nurses, allied healthcare professionals, and those are unified across the country, although there is still separate processes depending on whether that person is working in Dubai or in Abu Dhabi or in the Northern Emirates, in which case there's a slightly different process. So perhaps in terms of the word unified, there could be a little more work done around that unification. And I'm thinking really in terms of making it easy for professionals to move from one job to another, from one emirate to another, and for those transitional processes really enabling people to work more easily. There has been a very encouraging development in terms of visas for healthcare professionals. It's now possible in some circumstances to have a 10-year visa, a golden visa, and again, cementing those individuals in the country for a much longer term vision.
Really helpful. Haida, your camera's not on. I'm hoping you're still with us. As a healthcare provider yourself, how have you found the situation as far as workforce is concerned? Are you finding it easy to fill the vacancies that you have amongst doctors, nurses and allied health professionals, or is that becoming more of a challenge?
Well, I think in healthcare, it's always a challenge finding the manpower that you require and the right manpower. Definitely in the pandemic, there became a huge pressure on nursing manpower, specifically for a period of time, especially with the uptake of PCR testing and COVID facilities. And I think a lot of the nursing manpower had to move towards these points of gravitation that were attracting a lot of the nursing manpower. So we did struggle for a little bit there, and we had to obviously create additional incentive schemes to keep our nursing staff at that difficult time. That was for a kind of a brief period of time. I think things are normalizing again with, as you know, UAE gets the largest bulk of its manpower from abroad. So with the opening of borders and the ability of sort of nursing and doctors to come from abroad, I think that kind of allows things to normalize a bit more.
I believe, like Andrea said, the change in regulations and a lot of healthcare professionals, doctors and others getting golden visas helped the stability of the sector and attract more healthcare professionals to the UAE. And this is only the beginning, and I think it's going to attract a lot more with the new academic structure as well, and building a stronger healthcare system that is more internationally recognizable, that will also bring in more qualified healthcare workforce into the UAE. So I think in the short term, we already see improvement, and the longer term, I think it's going to get even better for the UAE in terms of attracting talent and attracting healthcare professionals of the highest caliber.
Thanks for that, Haider. I think it's a really interesting point that you raised. One thing that I think I've seen some activity and some conversation about over the last few months is the idea that the DHA have come up with of creating this fellowship program to try and increase the levels of capability and the levels of leadership. Osama, I wonder if you could tell me, what do you know about that? What can you tell us about the fellowship program? And is your camera working? Because we seem to be having some problems with people.
Hello. So with regard to the program, so now we see DHA is focusing more and more on training, and they are putting a lot of weight with the health education department, who are bringing a lot of new fellowship programs. This could be a part of the DHA level, and there's also another program at the federal level as well, to create some sort of an Emirati board for specialties, to support doctors to get an Emirati board for different specialties in healthcare. And I believe also we see more of strategic initiatives coming to the place now with regard to enforcing the workforce development within our program. So we're making sure that we attracting the good quality clinicians with regard to doctors, nurses, and even technical people within digital health is a challenge. But I think the more difficult challenge is to retain them. And to retain them, you need to have strategic development program to make sure that they progress in their career, they get more certification and more promotion within their career plan. So I think we are working a lot on this area specifically. We are putting even kind of platform to support this and to monitor what's happening with regard to the numbers of clinicians who are coming or who are leaving, trying to understand the trends, so we can address all these challenges and respond to them in a very quickly time. Yeah, so this is very important. Thank you.
It's nice to see. I mean, it's nice to see the Dubai Health Authority and the Dubai Health Economy addressing the issue of workforce. It's clearly a shameless plug for tomorrow's session at the Healthcare World Festival, where we have the Director of Workforce at the World Health Organization, Jim Campbell, as our main speaker. Workforce is clearly going to be a massive problem globally over the next 10 to 20 years. And for a health economy like Dubai's, where you are, as Haider said, reliant on being able to attract healthcare workers from other economies, having that program to make it attractive to retain staff by developing them and giving the opportunity to train and develop, I think is a really, really important thing. I'd like to welcome Isabel Arango to the call from Mott MacDonald. Isabel, nice that you were able to get in. I know you had some technical problems. And a little bit, unfortunately, late to the party, no fault of your own. I wondered if you'd just like to give us your overview of where things are in the Dubai health economy. From your point of view at the moment, how are things looking and where are the areas of opportunity? And you've managed to make it to the call, but you've still muted. Oh. No, it's not looking like, for some reason.
Hello. I think there's a delay.
Right.
Hi, Steve. Thank you so much, and apologies again. From my perspective, there's a tremendous need on specialty care, as you know, in Dubai, specifically in areas such as rehabilitation and specialty care. I think this also is to the point of everyone else's workforce. I think this carries with it as well as a specialty workforce. That's extremely important in order to provide these services. But I do see a pickup Post-COVID, I do see a need specifically in medical tourism as well. It's exciting times. But from my perspective, value-based healthcare is something that's in the arena as well. So it's not just how we provide healthcare and how much healthcare we can provide and what specialties, is the value that we're bringing to the city, to the practice. And it's a different way. Saudi, for example, has already incorporated value-based healthcare. So I'm seeing a push towards value-based healthcare. And what this brings is probably an increase in outpatient care, whereas the cost to provide outpatient is a lot less than inpatient. So there's a shift that we're seeing towards specialty care and outpatient care and the corresponding staff in order to incorporate those changes. I think from the perspective that they just mentioned of staff as well, I think specialty staff in the areas of administration, both clinical and non-clinical, are an essential part in order to deliver the strategies and the healthcare component that we're looking at right now with healthcare tourism and everything else. So it's not just manpower, it's the right specialty manpower. And those have been challenges in the past, but I see a trend now towards more specialty care and more specialty staff in order to provide that care, both administrative and clinically. So exciting times. I think the pickup after post-COVID is going to be with us for a while now, and it's exciting times, at least in the UAE.
Are we starting to see? I mean, where are we in terms of medical tourism at this particular point in time? I mean, clearly, medical tourism for the last 18 months has not actually been possible.
Not.
You can't exactly travel abroad from treatment.
That's correct.
Travel abroad.
That's correct.
It remains an ambition of Dubai's. Where would you say it is right now? Is it?
Well, we've seen the numbers actually increase in the private sector for medical tourism in the last month or two. So with the easing of COVID and the easing of restrictions and the coming of Expo, we've seen an increase in the last month and a half, I would say, or a month or two. So that's exciting and that's very promising because, as you know, during COVID, it was completely flat, as was elective surgery. So those are exciting times that things are starting to pick up. And I think the boost from Expo to our medical tourism has also been significant, at least in the past month. So we're hoping to see the trend continuing.
I'm glad that you mentioned Expo, actually, because I want to spend some time thinking about not just Expo, but our next big event, our first very exciting in-person event for quite some time at any scale anyway, is going to be Arab Health at the end of January, which also combines with Expo. And from a Healthcare World point of view, again, shameless plug, we have our stand and we will have our special edition of the magazine available at all the entrances and a whole range of events going on over the course of the week. Drop me an email if you're interested in attending any of those things. But I want to think about the opening up of Expo, the Arab Health coming up, and what kind of overseas organisations should we be encouraging to enter the Dubai economy? What kind of needs are there in terms for suppliers, for companies, for innovators? And Marwan, I think you're at the cutting edge of this in terms of being one of the first points of call for innovators coming in from overseas. What kind of suppliers, what kind of companies should be thinking about the UAE at this moment in time?
Well, I mean, I think you can't really pinpoint and choose any specific types of companies, because in healthcare in general, whether it is pharma, biotech, medical device, digital health, there is something happening in each and every sector or subsector. And because Dubai and the UAE positions itself as a hub for the entire region, what you need to think is, you think locally, but also regionally at the same time. And most areas of healthcare represent an opportunity today because of various reasons. One is the whole digital transformation that a lot of the majority of the sector is going through, whether it is an increase in the hospital building capacity that a lot of the regions are looking at. So we have seen an increase in all of the areas of healthcare, but the biggest one has been digital health so far.
And I mean, I'll come to Mazin on this question. Are there particular areas of digital healthcare? Are there particular technologies or particular types of digital healthcare company that should be thinking particularly about entering the Dubai market from your point of view?
I would choose two. One would be anything that improves integration between payer, provider, patient, insurance, because there are a lot of moving parts, right? And it's quite complex. So anything that improves that integration is more than welcomed. And the second one is anything that is patient centric. So a lot of the systems today, or the solutions today, have been developed in the way that it ticks a lot of boxes, whether it's ISO or HIPAA, etc. But it doesn't really look at the patient experience. Why can't we not have an app or an experience that is similar to social media? Today, for you to go on Snapchat or Instagram, you don't need a training manual. You just learn as you go. It's so easy. There are icons, etc. So I think there is a big lag when it comes to making the patient experience as smooth as possible, and hence basically encourage more digitization.
Mazin, same question to you. Are there particular areas of technology that you see a need for?
Sure. Convenience is going to be the name of the game, and that was mentioned earlier. InsurTech, Femtech, you'll see the rise of these words a lot, and these trends where you bring in apps and mobile solutions in the area of insurance, and female health and women health. That's another growing area. Wellness, definitely I see wellness and well-being, healthy lifestyle is going to become the rise of, they're going to be an area of huge exponential growth.
Andrea, to come to you on this question about organisations entering the market, have there been any changes to, or how easy is it currently for overseas companies to set up in Dubai?
There have been a number of developments with regard to the ease of doing business generally, as well as the ease of doing healthcare business. If we start with some basic building blocks, we have a law in the UAE called the Companies Law that governs how companies are established. And there have been some recent changes to that, which now allow 100% ownership of companies, what we call onshore in the UAE, as well as those 100% options in free zones as well. We also have some additional changes into federal financial free zones of the Dubai International Financial Center and in the Abu Dhabi Global Market, which allow opportunities to establish holding companies in these free zones that can then own shares in companies onshore, and putting in place perhaps slightly more sophisticated arrangements for setting up the corporate structures here that give protection to foreign parent companies. So that's very advantageous. So that's on the general kind of corporate commercial side. In terms of healthcare, refinements are always being made to streamline obtaining health facility licenses. There is a unified set of national private facility licensing guidelines, which are helpful. They are implemented in each of the health authorities in a slightly different way, but there's a large degree of commonality. There are coming on stream new specialties, new subspecialties, additional activities for doing different kinds of business. So we are seeing a lot of establishments at the moment. We're supporting a lot of international clients on their setups, a lot of UK clients on their setups, whether it's from cosmetic surgery through to mental health, through to establishing polyclinics across a number of subspecialties. Actually, all parts of the sector, you're going to the earlier speaker's point, where there's a need across the board because we have a lack of facilities, a lack of specialties across the board. We're seeing activity generally. And when you look at the master capacity plan for Abu Dhabi and similar plans in Dubai, occasionally you'll see the word oversupply. But actually what it is a consolidation of supply in certain areas of the city of Abu Dhabi, or within the city in Dubai, whereas we have significant undersupply in other perhaps less attractive areas of the cities or the Emirates. So we don't have a real oversupply in any area, and we need to focus on having adequate supply across the board and then building those specialties, building those centers of excellence.
Also, while I'm with you, just to come back to this point around the development and the rise of digital health, I think I heard I think it was Marwan, no, it wasn't Marwan, it was Osama was talking about equivalents to HIPAA, equivalents to GDPR. How difficult is it from a digital health point of view to deal with regulation around data in Dubai?
It has been a challenge. Let's look at some basics. We don't have a unified data protection law similar to GDPR or HIPAA yet. There may be something coming down the track at us fairly soon. What the ministry has done is to put in place a federal regulation governing patient healthcare, the ICT Health Data Law. That's a transformational piece of legislation that really sets the agenda for data. More recently, there's been a cabinet resolution clarifying some uncertainty about which types of data can be sent offshore. That's a big red flag topical issue for many clinical providers who are establishing here that have operations in other jurisdictions and need to manage the data from an international perspective. So much has been done in recent months to clarify the law in that regard. We don't have a complete free-for-all in terms of sending data offshore, neither should we have that free-for-all. There are significant governmental data security concerns over patient health information. It's quite right and proper that there are proper mechanisms and limits in place on those data transfers. A lot is being done. We know that there is new regulation coming down the line. This has been a challenge for telehealth providers and those who are operating international second opinion services. But what we see is ministries working collaboratively with the private sector to address these challenges.
Really helpful. Farah, I want to give you the chance to comment on this, because obviously you work very heavily in the data and information area. How easy or difficult are you finding it to deal with data regulation in Dubai?
I mean, as an organization, we align ourselves to individual country laws. So the data needs to stay within the country, and that's how we operate. I agree. I think there is a lot of work that needs to be done in terms of clarifying data ownership, data privacy, confidentiality, laws that govern interoperability. Because if we are looking at unifying, 3 health information exchanges across the United Arab Emirates, Riayati, Malafi, as well as Nabid, in time, if the data exchanges across these 3, then how, who owns the data, and what are the laws that govern? Because if they create a marketplace, and if they do create, more possibilities of data monetization and commercialization to different startups or different organizations, then you will start getting into debating over ownership, confidentiality, privacy, and the laws that govern whether the data needs to stay on the cloud, on premise, should it leave the country, offshore, onshore, and yeah, those aspects.
It sounds to me like on the one hand, you've got a situation where the laws and governance around data is not yet fully mature, and the picture is still emerging. But on the other hand, there seems to be, to come back to Mazin's original explosion of legislation, there seems to be some flexibility and some movement in terms of a will to try and kind of move these things forward and sort these things out. Haida, from your point of view, the practical experience of dealing with this, because clearly you've managed to develop what sounds a very impressive offering around digital health for your patients. How have you found the issue of dealing with the data laws? Haida, are you there?
Yeah, well, for us, that has been obviously always built into the offering in terms of making sure that no data is shared outside the country. If we need to use some level of data analysis outside the UAE, then proper encryption, decryption sort of takes place. And it's not been in any way challenging. I think we've always, as an organization, maintained a very high patient confidentiality standards and data governance standards. And as Al Futtaim, as one of the largest family-owned conglomerates in the region, we have always been very, very strong on data security. So for us, that's been just operating within the norms, and we've not had any challenges there, to be honest. As we get more sophisticated with our patient engagement solution, this becomes very important, obviously, and we're continuously monitoring the best practices in order to be within those lines.
Isabel, to come to you on this, is this an area that you've had much experience in?
Well, yes. From my perspective, data integration is key, specifically among big players and big private players. In order to standardize procedures, you need that data integration. And that, I think, poses a great challenge. But I agree, patient confidentiality with Dr. Haider. Data security is very important. And I think the UAE has made great strides towards that. But from my perspective, I think in the past, data integration is key, particularly in countries that want to standardize healthcare, they want to monitor healthcare, and this always poses a challenge. There's different players, different models of system. So my focus is on data integration and standardization when it comes to these type of issues, as well as patient safety.
In a healthcare system like Dubai's, I mean, again, I come from the UK, so at the end of the day, we have the dominant player in the NHS, who is also clearly the dominant player in terms of data ownership. Where is the data owned in a system like the UAE, where you have insurers, providers, etc.? Who owns patient data? I don't know who wants to come in on that question.
Good question.
Well, shall I try to eat that elephant, Steve?
Go for it.
Okay. There are provisions in federal law that says that the patient initially owns their data. Okay, so the patient has ownership rights. The issue comes in terms of the creation of that piece of electronic data. You know, it's created by a health facility, then it's held in a central health information exchange. So those organizations then take on a custodianship role for that data. From there on, it then becomes very complicated because those custodians can only do things with data if they have patient consent or if they have some other kind of state authority that exists in a law or regulation. There are some intricacies around that. But to Mazin's point, if that custodian, data custodian, wants to do something with the data, you then de-identify it. It no longer becomes owned by the patient. It's the custodian's de-identified piece of information because it's a newly created piece of de-identified data. And then you can go and do analytics and whatever. The problem now is that, computer systems, AI algorithms are so clever that it's quite easy to re-identify the data after it's been de-identified. So what on earth happens then? and what happens with regard to the patient's genetic data or their genomic data, their full genome sequence, which is their unique identifier. And there is a school of thought that says it's impossible to de-identify it. So we've got some critical issues ahead of us on data ownership and custodianship in the UAE with regard to whether data is truly capable now of being de-identified and what we can do with it going forwards.
And is that an issue that is peculiar to the UAE, or is that a problem that we're seeing globally?
This is a global issue now.
Mm-hmm. Mm-hmm. I mean, what does that mean in terms of, I guess, because what I want to spend the last 15 minutes on is really thinking about how organizations from outside of the region enter the market. So I guess to kind of try and tie this together, if I can, how do these issues around ownership of data and around data law, how do they affect the ability of digital health companies to enter the market? I know, Mazin, we haven't heard from you for a while. Have you got any thoughts on this? If he can get his mute off.
That's a very good question. Yeah, that's a fantastic question, and I think one of the major steps when an organization comes into the UAE is definitely, number one, is to review the regulation that comes into that. So the health ICT data law, make sure that the compliance is there, and also that encourages organizations to find partnerships. Local partnerships could actually enable companies to get to work in compliance with the rules and policies that normally looks after, custodianship, ownership, privacy, and confidentiality. You'll see a lot of local companies coming up, such as Itisalat and Moro, and organizations that are locally bred and able to provide some sort of a platform that is much more compliant with the rules and regulations. But again, it might be an opportunity for more analysis, more studying of the market, specifically for organizations who want to come into the country. I think that's my thought.
So from that point of view, Isabel, I'll come to you next on this one. What sort of, if you're looking at, I mean, and Mox obviously is a UK company. You work with a lot of other UK companies that want to enter the market. What's your advice in terms of how people should go about starting to look at and starting to think about entering the UAE health market?
Well, I think the first step is to become educated. There are players that actually feel that the market is the same as other markets. And I think the first step is actually to become educated specifically in this market, know who the players are, know where the opportunities are specifically, because some players believe, well, just healthcare general. No, there's opportunities specifically in different sectors. So I think it's important for outside to spend some time, outside investors, to spend some time actually, especially if they're not into healthcare, spend some time educating themselves and perhaps joining with other companies that either a consortium or other companies that can help them in this process. So I think spending some time, which sometimes is not, actually educating themselves where the needs are, how the processes work, comes a long way when you're an outsider coming into this field. And also knowing where, what the legal ramifications are, the different ways of doing business. I think that's very important and a step that's sometimes overlooked with enthusiasm of wanting to get into the healthcare market and not actually educating themselves on all aspects of the healthcare market, because this market is very unique in comparison to other markets. And it takes a while to actually instruct themselves and understand the specific market and where specific the opportunities are. It's not just in general healthcare. And also getting acclimated with the strategy of the countries. Many times that's overlooked So I think spending some time, quality time, either through partnerships and understanding the actual system itself and how it works and where the opportunities are, is the first step.
Haida, I'll come to you on this question because, again, I mean, if you think about the kind of companies, the kind of suppliers and organisations that are going to be coming out to Expo and Arab Health, ultimately, a lot of them want to come and talk to healthcare providers that they can sell their products and services into. As one of those providers, what's your advice to organisations and suppliers that want to approach you and your colleagues?
Well, I think from our point of view, healthcare is changing significantly. So there's obviously there are always the conventional types of products that you may require, like equipment and otherwise. But also, I think healthcare providers or smarter healthcare providers, in order to move into the future, they really need to think way ahead of the game. And I think a lot of healthcare organizations will become the Nokias and the you know, sort of Kodaks of the industry if they don't change the way they think and the way they behave. And the suppliers have to be equally robust in their ability to respond to these changing needs and to the changing environments, and obviously bringing in smart digital solutions, technologies across the board. You know, sort of one of the biggest challenges in healthcare always is going to be financial sustainability of the healthcare system. So we need to bring in solutions that maintain the sustainability, not increase the cost of healthcare, and preserve the overall long-term and short-term sort of well-being of the population without overly charging for that. So this type of thinking is critical to the type of supplier needed in the future market in comparison with the present and the past market. And I think, to me, that's the biggest differentiator, where, for example, we see a lot of companies now coming in with HIS solutions that bring in a lot of engagement, agility, yet much lower cost. And the conventional, super expensive HIS providers are no longer sustainable, and so on and so forth. So I think, to me, sustainability as well as sort of smart cutting edge solutions in both together is the way forward.
And what advice would you give? What's the one piece of advice that you would give to an organization if they wanted to try and approach you and approach the market as a supplier? How should they go about it?
Come to me with a solution that adds value to my patients by either improving quality, reducing cost, or basically helping me to become more efficient. So if you can do one of those things for me successfully, where your solution on the net of it adds value, saves money, or makes the patient experience better, then that's what counts. So we're no longer in the land of everything sells. I think we are a lot more selective right now, and we're sort of in the strive towards one of the best healthcare systems in the world. I think our suppliers need to be fully conforming with that kind of direction as well.
It's a perfect answer. Isabel, to feed off that, I guess this is what you were talking about early on in terms of driving towards a value-based healthcare. So what kind of solutions do you think fit in with the idea of value-based healthcare? What's going to help to drive costs down and outcomes up?
Efficiency, consolidation of services, a clear strategy on how to provide those services efficiently and in the current market. I think the days of endless spend on healthcare are over. I think efficiency starts within the strategy of the organization, how well, and the monitoring of healthcare systems, how well they're actually doing, and being accountable for that healthcare. I think a shift towards thinking about healthcare towards a more efficient, value-based, what are we getting for our spending? How are we improving that delivery of healthcare is key. I think this region has been absent for that for a very long time. And I think it's the shifting of the minds on how we can provide healthcare in a more efficient, standardized manner, I think is key. And I think value-based healthcare is here to stay, whether it's different forms of payments, whether it's consolidation of service, whether it's accountability. I think a shift in that, and that's what I was referring to before about the client being educated before he comes to this market and knows exactly where the trends are and where the needs are. So I think it's strategy based, and I think it's running an efficient market that will give you the returns that you want, both financially and clinically.
Andrew, you've been working in the Middle East market for some time now. Do you still see clients that come into the region expecting there to be endless taps of wealth and spend that they can tap into? Do people still think that money grows on trees in the Middle East, and do they need to think differently?
No, I think the companies that have got their sights on, not just the UAE, but the Middle East in general, know that those days are over. These companies, these folks are much cleverer than that. And the clients that I speak to come with, very well prepared, very well mapped out strategies as to what they want to do in country. But I think that the two important things, from our perspective as lawyers, are come with your strategy, be well prepared. But, within that strategy, it's still important to do full legal due diligence on what you're getting yourself into, because the laws are immature in some respects, continuously developing, which is a good thing. But with that comes very close attention to that changing regulatory landscape and what effect that has on perhaps a particular project or a strategy for wider expansion. And with a view to, okay, we're going to do this on day one or year one, but we really need to keep an eye on this year 3, year 5. How is it changing? I think the mistake that some clients make when they land is a rush to want to set up their company very quickly. We need to set up, we need to have a presence, without thinking actually, well, what kind of company is that going to be? There are a number of options. And really, it's not set up the company and think about things afterwards. It's let's look at the project. Let's look at the underlying rationale for the project. Is it a private sector enterprise? Are there going to be public sector considerations? If this is going to be a collaboration with the public sector, are there going to be any particular governing laws? I mentioned earlier in the presentation, public-private partnership laws, very important. Procurement law, very important. These two streams of governing law will affect the whole structure for the project. It will affect the corporate establishment, and it will affect the governance for the project going forward. So if I were to make just one recommendation, of course, it's do the legal due diligence, do it thoroughly, don't take any shortcuts, and all will be well.
Is it any longer necessary, or has it ever been necessary, to actually have a physical presence in the market, to have an entity in the market in order to do business in the region?
Broad brush principles, yes. If you're doing business in the country, there should be a corporate vehicle established to support that business for many, many reasons. It goes to the core of the governing laws of the country, but also to properly address all matters concerning liability risk, which is obviously incredibly important to all companies. There may be some circumstances in which it's not necessary to set up a company. And it may be because actually, when you look at it, the services are not being provided from within the country. It's a very finely judged balance to assess whether that's an appropriate in any particular case.
Useful. So 1 minute left. I want one quick single sentence comment from each of you, please. What is your number one, in one sentence, what is your top tip for any overseas organisation looking to enter the Middle East health market? Farah, you're smiling, so that means you've got an answer.
Yes. Can I have 2 tips?
You can have 2 tips.
So the first one is, healthcare is a very local subject. Yet globally, locally, or regionally, in the Middle East. If we keep patient at the center, I think that would be a good start for companies. Keep the patient at the center. And two, bring a lot of sunscreen.
I particularly like the second one. Isabel, apart from sunscreen, what's your other top tip?
What value are you bringing to the system? And strategize.
Perfect. Mazen, lastly to you.
So collaboration and education, those are the two major words that I will focus on. Collaboration is number one, education definitely, and being able to move agile as well.
And can I also thank your the younger generation of the Qadir family for chipping in that little bit at the end. So look, it only remains for me to kind of summarise, and I'm going to summarise very, very briefly. It's great to see. From a personal point of view, I've missed Dubai. It felt like a second home over the last few years. The number of times that I've taken UK companies and other companies out there, been to Arab Health, been involved in the Middle East health economy. It's going to be lovely to regenerate some of those old friendships when we get back out there for Arab Health and Expo at the end of January. But it's great to see that the Dubai health economy is very much alive and kicking, that it has weathered the storm of coronavirus. It sounds extremely well. There is really great innovation going on, and Haider, I think, demonstrated that from the point of view of the great work that's going on with his primary care organisation. It is still a land of opportunity. It is still a place to be, and I think a great place to start for organisations looking to export in the health sector, because it remains hungry for innovation. It remains hungry to become a world-class health system. It is becoming a world-class health system, and I'm looking forward to seeing you all there at the end of February. Thanks very much. Final session of this November's Healthcare World Festival is tomorrow. Big plug for that one. It's going to be on the global workforce crisis. It is going to feature the head of healthcare workforce at the WHO, Jim Campbell. Hope you can join us for that one at noon GMT tomorrow. Thanks very much to my panel. Thanks to Andrea Tycott from Altamimi, to Isabel Arango from Mott MacDonald, for Farah Sheikh and Mazen Qadir, both from IQVIA, to Marwan Abdulaziz Janahai from Dubai Science Park, Haider Al Yousaf from Al Futtaim Health, and Osama Al Hassan from